I think it's 10:30. Can we start?
Yes, Lina, we can.
Okay, fine. So, very good morning to one and all. On behalf of the Indian Association of Oral and Maxillofacial Pathologists, it is with immense pride and joy that we welcome you all to the very first session of the first ever IAOMP National Webinar Series. This pioneering initiative marks a significant milestone in our association's academic journey, ushering into a new era of structured virtual learning, collaboration, and national engagement with the oral pathology community. At the heart of this visionary beginning is our honorary president, Dr. Srinivas S. Vanaki, whose leadership has been both inspirational and transformative. His forward thinking approach, strong academic ethos, and unwavering commitment to the growth of oral pathology has created a solid foundation for initiatives like this. We deeply appreciate the relentless efforts of our Honorary Secretary, Dr. N. Gururaj, whose meticulous coordination, passion for academics, and consistent dedication have made this idea into a reality. And his tireless behind the scenes work has ensured the smooth rollout of this series. A special note of thanks to Honorary Treasurer Dr. K. Lalit Prakash for his steady support and to all IAOMP committee members and the office bearers whose contributions and enthusiasms continue to strengthen an academic mission like this. Now I request and invite the President IAOMP to share a few words and inaugurate the session.
Very good morning, everyone. Respected senior IOP members, former president, and the young IOMP members and the youngest ones also. I'm very happy to be the part of this inaugural IOMP webinar series, which we started today. Although we had a lot of ideas which were put forth by most of you all, it's not the only idea that came into only few of us. It is the ideas which were suggested by most of you all, which we had like extended discussion in the EC meeting, and lot of suggestions were made, and we had this in our mind, and I'm very happy that we started this with the first webinar series from IOMP, starting with Dr. Varun Surya and moderated by Dr. Punya. We have so many other things to implement and start. I hope this will be a good beginning. And our main idea is not to have only few academic activities done through IOMP. We wanted to have so many more activities to be done. And this was one of the webinar series which we wanted to start officially from IOMP. Although we keep on conducting a lot of webinars at college level, but we wanted it to be done officially through our association, so that we can think of a lot of youngsters to get a chance to do their presentations, so that they also will be showing their talent, and which is not shown, probably they don't get actual platform to do their presentation. In this regard, actually invite the youngsters to come forward and give IOMP webinars like this, so that people will be known, even the our younger generation who also have bright future in the days to come. And I'm very happy to see so many registrations done, and I'm very thankful to our IOMP office bearers, especially Dr. Gurraj, treasurer, and all the EC members and seniors, advisors, for giving us a lot of inputs to start these kind of activities beginning in this particular academic. I hope this will be continued. I'm very happy to have Dr. Varun Surya as a speaker, and the topic what is chosen is absolutely correct. Computational pathology, digital shift in the diagnosis. From light microscopy, we all know that we are into the artificial intelligence and digital pathology, and so many more to explore. And I hope this will be a good beginning. And we have another excellent moderator, Dr. Pune. Both are academically equally good. I hope this particular beginning of nice topic will initiate lot of youngsters to come forward, and give we want to give big platform for all of them to do webinar like this in the days to come. I hope I know I'm very happy to be part of this. I'm very happy to inaugurate. I hope everybody is eager to listen to Dr. Varun Surya, his lecture. I hope I also will be part of it, and want to listen to his lecture. So all the very best, Dr. Varun Surya, and I'm very happy to officially initiate and inaugurate this IOMP National Webinar Series started on 30th July 2025. It is just a beginning. No, we have lot many more things. I hope, with your support, we are going to do it in future. Thank you so much. And Dr. Varun, all of us are happy to listen to you. Thank you so much.
Thank you, sir.
sir.
Thank you
Yes.
for officially inaugurating the session. And as Sir said, we are truly honored to launch a series with a highly relevant and futuristic topic, computational pathology, the digital shift in diagnosis. And our esteemed speaker, Dr. Varun Surya, Assistant Professor at AIIMS, New Delhi, is a national voice in the integration of artificial intelligence and digital innovation in oral pathology. His vast contribution in oral cancer diagnostics, AI-enabled tools, and translational research have been path-breaking. We eagerly look forward to the knowledge that you will share today. And with that, it's my privilege to hand over the session to our distinguished moderator, Dr. Punya Angadi Rao, Professor and Deputy Director of Research at KLE Academy of Higher Education and Research, Belgavi. So a few words about Dr. Punya Angadi Rao. Dr. Punya V. Angadi is a distinguished oral pathologist with over 20 years of academic, clinical, and research experience. She holds a BDS, MDS, and DNB in oral pathology from SDM College of Dental Sciences, Dharwad. She further earned a PhD in oral pathology with focus on oral cancer and cancer from KLE Academy of Higher Education and Research, where she currently serves as a Deputy Director of Research and Development Cell. In addition to her core training, she also holds a postgraduate diploma in bioethics and a fellowship in forensic odontology. Her research contributions span 4 critical areas: oral cancer, OPMD, artificial intelligence in early cancer diagnosis, and forensic odontology. She has authored over 130 publications and indexed and peer-reviewed journals. She has been honored with several accolades, including the Best Teacher Award, Young Scientist Award, Best Scientist Award, and Outstanding Research Publication Award, and conducted various workshops in international and national platforms. Over to you, Dr. Punya, for moderating the session.
A warm good morning to one and all. Thank you, Dr. Leena, for your kind introduction. I'm indeed honored to be the first webinar of the series introduced by the Indian Association of Oral and Maxillofacial Pathologists. I wholeheartedly thank Dr. Srinivas and Dr. Gurraj for giving me this opportunity. And I congratulate all the office bearers of IAOMP for taking up this initiative, which reflects the association's commitment to foster academic excellence, continuous learning, and professional growth in oral pathology. Without further ado, I deem it my pleasure to introduce today's speaker, Dr. Varun Surya. Dr. Varun is currently working as Assistant Professor in All India Institute of Medical Sciences, CDR, Delhi. He is also the in charge of the Computational Pathology Lab at his institute. He has completed his BDS from Maulana Azad Medical College, Delhi, and then completed his MDS in Government Dental College, Mumbai. He also has a fellowship of Indian Board of Forensic Odontology. He has more than 30 publications to his credit in peer-reviewed index journal. He has presented numerous papers and has also been invited as guest speaker in various reputed forums. His areas of interest include oral cancer, potential malignant disorders, digital pathology, artificial intelligence, medical device development, forensic odontology, to name a few. He has also been a recipient of several extramural grants to from various national agencies like ICMR and Ministry of Education. In fact, I'm glad to say that we are working together in 2 of the projects. I now invite Dr. Varun to begin with this session. I request all queries if you have after the end of the session.
Okay. Good morning. I hope I am audible to everyone.
You can share your screen, Dr. Varun.
Okay, ma'am. Okay, ma'am. First of all, I think we can mute the audience if possible. Yeah.
Shilpa madam, please mute all the audience, madam. Shilpa madam, Shilpa madam, please mute all the audience.
Okay, I hope I'm audible now. Okay. So
Yeah, you're audible, Dr. Varun.
okay, so good morning, all the esteemed seniors and fellow oral pathologists. It's an honor to take the first ever IAOMP webinar on this platform. Good morning to all my seniors like Ma'am Alka Kale ma'am, Hazare sir, Vaniki sir, Punia ma'am, Tabitha ma'am. So I will be sharing my screen. I hope my screen is visible. My PowerPoint presentation is visible.
Visibility.
Yeah, presentation is visible.
Thank you. Thank you. Okay. So just a second. Yeah. Okay. So today I will be discussing about the future of pathology that is called as computational pathology. We can divide the timeline of pathology into three phases. First, it was the traditional pathology. Second was the digital pathology, and upcoming future of pathology is the computational pathology. So this is the traditional pathology workflow which we all follow. We prepare the slides, we see those slides under microscope, then we document our findings, we write our reports. And if we want some consultation, we will take physical slides, we can go to our fellow pathologist or other oral pathologists for their opinion. So how does computational pathology workflow is different and what is about computational workflow? So in this computational pathology workflow, the most important is digitizing of the slides. So first we go for digital imaging using the whole slide scanners that will give a whole slide image, WSI. Then we will analyze those images using our models, and side by side we are also developing our AI models. Now these AI models will help in clinical decision support system. So this is the entire workflow in brief of computational pathology. So how we can define computational pathology in simple terms? So basically it's an interdisciplinary field that use advanced computational techniques such as artificial intelligence and machine learning so that we can extract the meaningful information from the pathological slides and we can arrive on a diagnosis, automatic diagnosis by our AI models. So these are the applications of computational pathology. Obviously, it can serve as a support clinical decision system. In the departments where there is huge load of pathological slides, they can be bias, they can be, tiredness, they can be fatigue of the pathologist. So in those systems, these models can give us a, recommendation or a provisional diagnosis, and they can reduce our load. Then we can do the big data analytics. What is big data? This is a very vast data because in medicine or in pathology, we are dealing with medical images, especially histopath images, clinical images, radiological images. So we can analyze those data using big data analytics. It can enhance our diagnostic accuracy because we are using an unbiased system for the initial screening. It can automate routine tasks, for example, writing a report. It can provide us a brief outline of the report, which we can further refine and give to the patient. And it can also enable the quantitative analysis of the histopathological slide and even the IHC slides. So these are the application of the computational pathology. So computational pathology is basically an integration of the pathology and artificial intelligence. So just a brief about artificial intelligence and its sub-branches. So artificial intelligence is nothing but simulation of human intelligence by the machines. Now we have several sub-branches of AI, including machine learning. Within the machine learning, again, we can have many other branches, but the most important is deep learning. Why deep learning? Because deep learning can help us to analyze the images. And in pathology, we are basically interacting with lot of images. Then we have natural language processing. It is also one of the sub branches of AI. This helps in analysis of the voice, like we are speaking and some AI model is working in the background on the Zoom to take out the minutes of the meeting. So that's an example of natural language processing. Then we also have computer vision. Recently Tesla was launched in India, and we all know that Tesla can auto park itself. So how does it happen? Because they have sensor, they have cameras, and they have the speakers and the voice sensors. So they can approximate the parking space. So it's an example of the computer vision, which is a sub branch of the AI. So these are the few of the branches of the AI. Now, how does digital pathology is different from the computational pathology? I have told you that they can be three, you can say, phases of pathology. One was the traditional pathology. Then right now, many of the institutes are, practicing digital pathology, and the future is computational pathology. So what is the difference between digital pathology and computational pathology? So digital pathology simply means digitization of the process which we are doing in the traditional pathology. That is image acquisition, storage, and sharing. Many of the colleges, they take snapshots of the slides, and some of them can have also the scanners, the whole slide scanner. They can scan the slide, digitize it, and they can store them in their drives. So the core technology involved here is whole slide imaging. The goal here is to enable remote viewing, means we can share our slides online in place of the physical slide. Suppose I am sitting at AIMS and madam is sitting at KLE, and we want to discuss some slides. So if we have the digitized version of the slide, that is WSI, we can share, we can discuss those slides online also. So how does computational pathology works? Computational pathology is basically application of AI ML models to analyze the pathological data. So here the primary focus is on data analysis, feature extraction, and model-based interpretation. Means the model is doing everything for you. It is analyzing your pathological data. It is taking out the features which are important, like how many mitotic figures are there, or maybe what is the percentage of Ki positive cells. And then it will give you a model-based interpretation, like whether it's suspicious or non-suspicious, dysplasia or non-dysplasia, cancer or non-cancer. So the core technology involved in computational pathology, or in simple terms CPath, is machine learning, deep learning, and image analysis. The goal here is to enhance diagnosis, predict outcomes automatically, and quantify the features. Moving ahead. So in AIMS, we have developed our first computational pathology across India. So what are the components of the computational pathology? So we can divide them into hardware and software. The most important component which is required for both for digital pathology also and for computational pathology is the high resolution slide scanners. They comes of different brands. We are using Hamamatsu slide scanners. Now we need workstation with GPUs. What are GPUs? They are graphical processing units. Since we are dealing with high, you can say terabytes or gigabyte slides here. So we need GPUs to process the images. Then we need fast network connectivity. Then we also need storage infrastructure. When we scan a slide, histopathological slide, it is of size of 1 to 5 GBs. So we need vast amount of space. So there are two options. Either we can go for physical servers, we can install them in our departments, but we have to maintain the physical servers. They should be, they should be temperature maintenance through for 24 hours. So in hot places like Delhi, we have to run the air conditioning for 24 hours. So it's a bit of, expensive and difficult to maintain. The second option is cloud servers like Amazon gives or Google gives. So we can also use them. And then we should have high resolution display monitors. So these are the hardwares which are required for computational pathology. Then what are the software requirements? So we need software which can help us in image viewing, in image analysis, and also for annotations. Then we need to have frameworks which can help us to build AI ML models. These frameworks are nothing but, you can say, platforms which have all the pre-built tools. For example, nowadays, if someone wants to make any pamphlet or PPT, they go to Canva, because Canva have all the templates. So it's a kind of a framework for making presentations or making, posters. Similarly, we have framework like TensorFlow, PyTorch, which have all the tools that are required to make AI ML models. Then we need annotations. Annotations are labeling of the pathological feature in a slide. So we need to have annotation tools and then data integration and management tools. So I will discuss them briefly one by one. So first, AI ML frameworks, as I've discussed, these frameworks are required to make AI models for any purpose. Models are built for certain objective. For example, we can build an AI model to check whether the dysplasia is there or not, dysplasia versus non-dysplasia. Or we can make an AI model for cancer versus non-cancers. Okay. So we can build different models for odontogenic tumors, different models for fibrous lesions, like that. So these are the frameworks like TensorFlow, PyTorch. And this is an example of two of these frameworks, which have all the tools on which you can go and make your AI models. Now coming to the annotation, annotation is the most important labor intensive work required both for digital pathology also and for computational pathology. So annotations are nothing but markings or labels on the digital images that identify spatial features of interest. For example, in a very simple case of oral squamous cell carcinoma, we see it is invading down in form of an island. We can see creatine pearls, we can see mitotic figure. So we need to mark these features so that the AI models can learn. This is called as annotation. So we can highlight tumor boundaries. For example, suppose this is a tumor, hypothetically, this is a tumor island. So we can mark its boundary, we can mark the nuclei, we can mark the tissue types. So annotations basically captures pathologist expertise so that the computer or the models can learn. So to do good annotation, you need to have sound knowledge of pathology. And these annotations will serve as a ground truth data for your AI ML models. So these are some of the examples which we do under our project of MIDAS, which is funded by ICMR. So we create benchmark data sets and we annotate them so that our AI models can also learn. So this is an example few of the annotations, like we have marked here mitotic figure, although the size is very small, but you can see we have marked certain cells and we have given them labels. So this is called as annotation. Again, suppose this is an epithelial island or creatine pearl, so we can also mark them and we can give them labels. So for doing this, we require annotation tools. So these are tools, or you can say software platforms, which can enable us to label the slides, classify regions of interest on the scanned images. Now these many platforms provide this kind of functionality, but we commonly use QuPath. QuPath is a freely available, very good annotation tool. It can also be used for image analysis. So this is an example of QuPath. It's freely available. I think it is developed by some of the university, and that's why it is freely available. So it contains all the tools. So we have to just upload our scanned WSI images. And those images, suppose this is an image, and then we can annotate according to our will. There is a freehand tools, or there are circular tools, rectangular tools. There are also text tools by which we can name those components, like this is an epithelial island, it's a mitotic figure, or something like that. Now, why annotations are important? So because good annotations means better AI ML model performance. If annotations are bad, the model will not able to learn. So good annotation, good AI models. So annotation represents the pathologist expertise. So it's like teaching a child, like we teach child, it's an apple, it's a banana. Similarly, we are teaching AI models. It's a mitotic figure, it's an epithelial island, or it's a lining of the OKC, or it's a lining of radicular cyst. This way we are teaching our AI model. So it's vital for the supervised learning. When it comes to AI, the learning, how we are teaching our AI model can be of two different types. It can be supervised learning or it can be unsupervised learning. Supervised learning means we are labeling our data. We are marking, or it's a mitotic figure. This is called as supervised learning. Unsupervised means we are not Now, few of the technical terms, although these technical terms Everyone come across these technical terms when we read articles on our AI ML models, because many of the researchers around the world are working on many of the AI models for histopathology. So we need to have some basic ideas about these technical terms. That's why I have included these terms in this presentation. The first one is PACS, then LIS, then data lakes, platforms, and clinical data warehouse. Very simple terms. So what is PACS? PACS is basically picture archiving and communication system. Since we are scanning our slides on routine basis, and we are storing huge amount of data. So we need to have a system which can store, which can help us to retrieval of the information, and which can also help in sharing of our images, be it pathological images or radiological images, or different type of even genomic data. So it replaces traditional film archives and enable digital workflow for the diagnostic imaging. Again, an example, like I have to share some slides. I have some doubt on a slide and I have to share these slides with, for example, with Tabitha ma'am in JDC Mumbai. So what I can do, I can upload those slides on these PAC servers, and I can give access to the ma'am of these PAC servers. Then she can also see the same slide and can give her opinion. Then data lake platform, it's a fancy term for basically for cloud storage. For example, in normal scenarios, Google gives us 15 GB of space, but this space is very limited. I have told you that for a single slide, WSS slide, the storage required is 1 to 5 GBs. So, by scanning 15 slides, your whole 50 GB data will be exhausted. So to store such a heavy data, we need to have, a very high storage in terabytes. So these are provided by different companies like Google Cloud Storage, Amazon Web Services. So it's just a fancy name for the cloud servers. Then clinical data warehouse. Now we have to integrate everything. Now we have some system which can, store the slides, which can help us in, retrieval of the slides. And then we also have the storage. Now we have to integrate everything with our, you can say, softwares. Like in a hospital, we have EHR, electronic health records, where we store patient data, which also stores patient pathological reports or every kind of reports. So anyone who is involved in the treatment pathway, surgeons or someone from the medicine or someone from the lab department, can see the patient data. So that can be possible by clinical data warehouse, where we integrate the data, which can help in search and retrieval, and it can also support AI and big data analysis. So we are integrating the existing system of a hospital with our AI models. And it can also give security and compliance, because we are dealing with highly sensitive patient data. So it's our responsibility to keep it secure, so there is no leakage. So why data integration and management tools are important? They enable seamless AI model training. They support real-time analysis. Now coming to WSI, there are different scanners in the market. All of them give output in different format. For example, we are using Hamamatsu scanner. So it's given output in NDPI format. Then we have Leica, we have Zeiss. So the problem comes when you have, two different kind of scanners, or you have, which are incompatible with the existing scanners. That's why it's very important that, the format you are using should be compatible with the softwares. So we are using Hamamatsu scanner, it's given NDPI format. Then we need to find tools which can support the NDPI format. For example, QPath annotation tool also support NDPI format. So what are the storage requirements? As I have told you, one single histopathological slide can run between 1 to 5 GB. So we need to have large amount of space. Then pyramidal tiling means we should be able to zoom in and zoom out. There is a WHO Blue Books, if you have come across it. So on WHO Blue Books, they have given WSI of each pathological cases. So you can zoom in, zoom out, you can go to different areas, you can see overall how does a tumor or cyst look like. So that is called as pyramidal tiling. Then we need to have storage infrastructure, we need to have data access. Now before initiating our AI models, we need to do some pre-processing of the images. Why? Because different labs give staining of different qualities. So we need to normalize it. So we have to adjust our color variation. Then we have to do stain separations, exact stain components. Sometimes stains are light, sometimes they are dark, sometimes there is a background. So within the software, we have this, options which can remove all the noise and can give us a very good contrast. Then we need to remove our artifact. Then we need to select region of interest. If we scan the entire slide, suppose it's a case of oral squamous cell carcinoma, and at only one place we are seeing invasion, and rest of the slide only contain inflammatory infiltrate. So there is no point of including those parts because they are going to increase our space. So we can only scan those invasive islands. So that is called as region of interest selection. And tiling is also very important because we need to understand how these scanners work. This scanner does not scan in a continuous manner. They take image of one part, then another part, then another part, and then those images are stitched together to give us a very continuous, scanned image. So this is called as tiling. Then there is one feature called as segmentation and quantification. This is the basic of how model is taking or extracting the information from a slide. So segmentation means the whole slide is divided into different segments. Like I've given an example, like there is a slide of OSCC and only one area is showing invasion. The rest of the area is not very important for us because it is showing the inflammatory infiltrate. So if we can only mark the region of interest, this is called as segmentation. Then what is quantification? Quantification means suppose we have to count the number of mitotic figure, or we have performed some IHC like Ki67 and we need to find out the percentage. This is called as quantification. So it can transform complex image into structured data for machine learning models. It can also enable the objective measurement. It can actually count the number of cells, which can give us a percentage of how many cells are positive or how many mitotic figures are there. Then some basic of machine learning, because this is the main division of AI which are integrating into pathology. So machine learning, they are, as I discussed earlier, they can be two broad divisions of machine learning: supervised learning and unsupervised learning. Supervised learning means we are annotating the data and we are feeding those data to our models. So the model is learning on the annotated data. And unsupervised means we are just giving the images, we are not marking anything. So the models are learning by identifying the patterns, like we learn, like we teach our child, this is an apple, this is a window, this is a sun. So children also learns by identifying the pattern. So in unsupervised learning, the AI model or the ML model is also learning by identifying the patterns. So there can be different use case of it. If we have small data and we have someone to annotate, because annotation is a labor intensive job. If you want to label or annotate a single slide, it can take somewhere between 10 minutes to 1 hour, depending on what is the region of interest, how many features we are going to mark. So it's a very time consuming process. And if we have a large data, so we cannot annotate the whole data. So if we have small data and we have someone who can annotate, then we can go for supervised learning. If we have large data and we are short on manpower, then we can go for unsupervised learning. So they can be applied in different scenarios. Now, deep learning in histopathology. So the overall ecosystem is called as AI. Within AI, the most important branch is machine learning, where it learns on its own without any prompts. And within the machine learning, you can say the domain which is of our concern is deep learning. Why deep learning? Because in pathology or in healthcare, we are dealing with complex data, and complex data require complex models. So in deep learning, we are making complex models which can understand complex patterns. And it has tremendous potential. We can do tumor detection, we can grade dysplasia, we can even subtype cancer, we can do biomarker identification, and we can also do nuclear segmentation to find out the number of mitotic figures. So again, few technical terms, because when we read those articles, they come across like, so they can be different types of deep learning. The most basic type of deep learning is called as artificial neural networks. Then you must have come across, if you have read some article on AI, about CNN, convolutional neural networks. So these CNN models, they are basically used for analysis of images. So that's why whenever we read an article of, making a model on histopathology, we come across CNNs, because these models are the ones which are being used for the image analysis. Now, suppose there is a scenario when someone wants to do some research. Nowadays, so even non-medical persons are doing, making models on histopathology, because it can be commercialized, it can be sold in the market. So the most important challenge is in data. To make a good model, good AI model, not for histopathology, for anything, like, AI is coming in every scenario. They are touching every aspect of our life. So to make good models, we need large amount of data. So some researchers want to do some research on AI and they don't have sufficient data. They can also create synthetic data, and that can be done by using generative adversarial networks. So using 100 slides or cases of OSCC, you can generate 500 cases. That is called as synthetic data. And it is so detailed that we cannot differentiate between the synthetic data and the real data. So we can even generate more data so that we can train our AI models. Now, how does CNN actually works? Suppose this is a slide. This is a slide, suppose, of an OSCC. So this slide is broken into different segments by the models. And each segment is studied by the model in a very complex manner. And then the output is given. For example, there are number of publications you can find over the internet, where deep learning models are used for different use case. For example, in this, the deep learning has been used for identifying epithelial dysplasia of tongue. So this is how they have done it. Depending on the pattern, depending on the level of dysplasia, the model itself can tell you whether it's a case of mild dysplasia, moderate dysplasia, severe dysplasia, or even carcinoma. Because I think this is a very subjective. We usually come across this issue, when I think 2 or 3 pathologists are seeing a case of dysplasia. Some will say it's a severe dysplasia, someone will say it's a case of mild dysplasia. Even there are certain cases where there is a lot of inflammation and we can hardly see some of the tumor islands, although clinically the patient is showing ulcerative lesion, means clinically there is OSCC. But within the slides, it's not very clear cut. Someone will say, okay, I can see some island. Someone will say, no, there is no island, there is only inflammation. So under these scenarios, these AI model can give you an objective opinion whether those islands are there or not. So this is one of the examples of deep learning model. Again, deep learning models can be used for the automatic detection of tumor regions. Means you just feed a slide and the deep learning model will run and tell you which parts are normal and which parts are abnormal. Like within this slide, the green markings represents the normal. Like here it's marking different tissue like muscle tissue, adipose tissue. So the model itself, it's marking whether these areas are normal or they are cancerous or tumorous. And these red markings are cancerous or tumorous areas. So the model can differentiate between normal and abnormal. Then I have talked about the quantification of biomarkers. So these can also be done by AI models. Like again, I will give you the same example of percentage of Ki-67. We use it for finding out whether the lesion is malignant or not. So these quantification, the number count is very important. So this quantification can also be done by the AI model. It can tell you it's 20%, 30%, 40%. So these are the applications of deep learning models. So deep learning models are the most common models which are used in our pathology. Now why it's very important to understand this kind of scenario? Because nowadays many companies are coming out with commercial AI models. For example, only yesterday I was going through my LinkedIn and I found that this company, IDGPath, have come out with their own model, which can be used as a second opinion for histopathology and for digital pathology services. This we have come across normally also, that we have given a diagnosis and that patient has gone to some other hospital. Now for performing surgery, they will be requiring slide and block so that they can also review. Or it's a small lab and we don't have any expert pathologist, but we have performed slides. We have performed the biopsy and we have the slides. Now we have to send those slides to a pathologist. Now, these can be done by these commercially developed AI models. So we can share our slides over the internet, and those slides will be analyzed by these commercially models, and they can give their opinion. So it's very good for second opinion. Many patients, many patients who are educated, they always go for second opinion. If a patient, we have seen such patients, which do not have any habit history of tobacco, still there is a suspicion of oral squamous cell carcinoma, and we have given those diagnoses in our report. So the patient does not, trust it 100%. So they want to go for second opinion. So in those cases, these models can be very useful. So how does this entire pipeline works? How can we, commercialize our AI models? So to all the youngster, all the, future of pathology, nowadays you can, make AI models and you can commercialize them, you can sell them, you can put them on subscription mode. So how does it happen? Because AI model are treated as medical device according to ICMR guidelines and also Government of India guidelines. So you can sell those AI models. So how does this entire system works? So first of all, obviously to train our typical AI model, we need to have lot of data, and we need to pre-process those data. Once we have that data, large amount of data, we can train our model. Then we can also validate and testing. There are three phases in AI. First of all, model training, then validation, and then testing. Testing is usually done on the external data. Suppose I have make a model on my data, but I want to see whether it also works on other data. So I can go to Punya ma'am and I can request her to give me some slides on OSCC. Then I can validate my model on those slides. Once it is done, then I can go to regulatory certification bodies. Like in India, it is CDSCO, in US, it is FDA, and they can give us certification. Once we have the certification with us, then we can commercialize our AI models and we can sell them in the market. So they are different. Then how to judge whether our AI model is good or not? So there are different validation matrices in computational pathology, or in any context. Like accuracy is there, proportion of correctly classified samples. Then we also know about sensitivity, proportion of actual positive correctly identified. Then proportion of actual negative correctly identified is called as specificity. Then we have precision, which is proportion of predicted positives that are true. Then we have F1 score and AUC. AUC, though all of us knows, it is area under the curve. So all these parameters are used to judge whether a AI model can perform good or bad. It's not that all the AI models will perform, very good. Only I think last month someone has given me an AI model to test, and when I tested it, when I put my own data, it performed not very good. The sensitivity was only 45%, although they were claiming it is 90%. But on my data, it is performing very badly. So not all the models will perform very well. So we need to use certain parameter to find out whether these models are good or not. And then finally, we need to integrate. Once we have our AI model, whether we have developed it in-house or we have bought it from somewhere, we need to integrate it into our clinical workflow so that it can work as a clinical decision support system. Like if we have a large amount of pathological workload, in daily basis we are coming across 50 or 100 slides. So for initial screening, at least we can use this AI model, and very soon it will be unethical not to use AI model. I think it has been become mandatory in Australia for certain cases of skin cancer. Means if you are not using AI, you are prone to miss some of the important features. So the government or the regulatory bodies had made it mandatory, or it's a compulsion to the clinician that you have to use the AI models, because AI model will give you a comprehensive, unbiased recommendation. So it can give us a clinical decision support system. Then user interface, once it is integrated into our college or hospital softwares, like we all of us has EHR, that is electronic health records, which contain all the patient data, patient lab reports. So once we integrate our models or our workflow into those software, then anyone can see those reports, anyone can do analysis. They are not dependent on anyone. So this is also a very, you can say, advantage of computational pathology. Then reporting tools, once we have integrated everything, then we can at least generate the initial screening reports. Now those reports can be discussed with our postgraduate, our senior resident, so that we keep continuing, continuing updating our AI models. Now, since we are dealing with very sensitive patient data, so there are some regulatory and ethical considerations like regulatory approvals. Meet device regulations like FDA in USA, CE in Europe. We also have our own regulations in India. For example, for data privacy, we have DPDP Act, Digital Personal Data Protection Act. So it mandates that you should secure the patient data. You should not let it, there should be no breach in the patient data, and you should not be sharing patient identifiers. You should not be telling which patient has cancer or which not, because there was an example, one of the villages has sued one of the NGOs or one of the papers, because they have published a report that this villages is a epicenter of cancer because number of patients are suffering from cancer. So what happened now? People are afraid to go to that village or do marriage in that village. So we cannot share the patient identifiers. We cannot tell that this person has this kind of a disease. Then fairness and bias, our model should not be biased. Like the example I have given, that if a model is trained on my data, it will do wonders for my data. But if the same model is used for some external data and it cannot perform well, then that model is not good because that model is biased. So there should be, the model should be unbiased. So it should be trained on diverse data sets. And then there should be transparency, means we should be able to explain why the AI is giving this kind of diagnosis, why AI is saying it's mild dysplasia, moderate dysplasia. So entire code, entire backend, entire fundamentals should be transparent. And then continuous monitoring. We need to, keep upgrading our knowledge, keep upgrading our data, so that our models, our entire workflow keeps on learning, so that, there is continuous betterment of the entire work system. So this is our scanner. This is a single slide scanner. We are now in the process of procuring multiple slide scanner. So this is a slide scanner. It comes with its own system. They have inbuilt softwares which can help in analysis of the slides. And in the background, we have the AI models which are learning. This is our computational oral pathology facility. So we have different sections for different works. So first of all is data curation. Whenever a slide comes, one of our researchers see whether these slides are of appropriate quality or not. So we have certain SOPs, certain guidelines to see whether these slides can be used for our development of AI models or not. So that is called as data curation. Then comes the second step called as data anonymization, means we need to remove all the identifiers, because if this data is leaked, then we will be obviously in lot of trouble. Now, in today's scenario, everyone wants your data. At AIMS, we have been approached by all the big companies like Google, like Amazon, G Healthcare, because they have the models, but they don't have Indian specific data. And India is a very huge market. We have lots of hospitals and labs. So if they want to sell their models in India, they need to prove that their models works better on the Indian data. That's why they are always after you to, they will push you to share your data, or, so that their models can learn. So it's a job of the clinician or the pathologist to anonymize your data so that no patient identifiers are leaked, and patient safety or security is, in place. So the first step was data curation. Once the data is curated, the second step is data anonymization. After that, we do annotations. Annotations, I have told you already, it is the marking or the labeling of the pathological slide, the features which are important to us or which we want the model to learn. And finally, from there, it goes to our last station where we train our models. So this entire workflow, it is very efficient. Once it's in motion or it's set up, we can train, we can analyze large amount of data using data. We need to have lots of spaces. So we can have either physical servers or we can have cloud-based servers. Here we are using both. So this is one of our servers with high storage running in hundreds of terabytes. This has been installed in a air conditioner facility where AC is running 24 hours. That's why it is also very expensive to manage these kind of servers. So this is installed in our basement. We also have a local servers to provide certain backup if something goes wrong here. And we also have web-based servers, so we can share our data because we work very closely with technical institute like IIT Delhi, IISc Bengaluru. So we need to share our data with those people. So we are also utilizing our cloud-based services. So this is the yield, although this is a very old data, but still this yield from computational pathology lab. So till now we have scanned more than 2000 slides, 20,000 data sets, high quality data sets has been created. More than 3,000 images have been annotated and around 3 models we have trained. So these are some of the models. See, models are based on certain objectives, the objective you want to achieve. Like suppose you want to make a model which can identify whether it's cancer or not cancer. So here we have used this ResNet 50/50 means number of layers. So this model was having, you can say decent amount of precision because the number of samples or the number of data is very less. We have only used 148. Then ResNet 18 model, it was for oral cancer versus no oral cancer. It has more, you can say precision around 85%. So if we keep feeding the data, if we keep, improving our model, our sensitivity, specificity, precision keeps on improving. So these are some of the publications which, since we are working in domain of AI and medical devices, so we keep sharing our experiences via publications. This is another recent of publications where we have discussed about the parameters which are required for this gold standard or benchmark dataset constructions and also data protections. And very soon we are going to publish our MIDAS Oral Hub project's yields. All the ontologies we have created, what are the workflows we have created, what are the SOPs we have created, and which annotations tool we have developed. So to conclude, the future of the pathology, I think within maybe not in India, but outside, within next 10 to 20 years, the computational pathology workflow will be established. In India, it will take another 20 years maybe, but it will come. It is the future. It is going to come. So it is going to increase diagnostic speed and throughput. It will improve accuracy and reproducibility. It will enable precision medicine research. Now, there is a lot of focus on, personalized treatment. Suppose there are two patients of oral cancer. One is very young, don't have any underlying disease. Another patient is old and have diabetes or other kind of underlying diseases. So treatment workflow cannot be same for both of them. So we need to personalize our treatment. So once we have the entire data set, we have the biometric data, age, sex, geographical location, we have the pathological data, we have the lab data like blood reports, we have the genomic data. Then we can give personalized treatment to every patient. And so that compliance will increase and the prognosis will also increase. So this entire computational pathology workflow can give you personalized work treatment plans. So it's basically a vision for future of diagnosis. There is a collaboration of AI, digital path, and molecular data for next generation pathology. Collaborative, data-driven, globally connected diagnostic practices are the future of the pathology. So with this slide, I end my presentation. This is our departmental logo. So in addition to pathology, we are also involved in AI, ML, we are also involved in genomics, and we are also involved in medical devices. And this is what we want to show in form of our departmental logo. Thank you very much for listening. Now I'm open to questions if anyone wants to ask. Thank you very much.
Thank you, Dr. Varun, for engaging and insightful sessions. You made a lot of the things very clear. Can you stop sharing your screen so that we can see you?
Sure. Just okay.
Yeah.
Thank you very much for that presentation. I felt that your presentation highlighted the fact that computational pathology is not the future, it's right here. It's
Right, yeah.
and it's quietly and steadily transforming how we are going to diagnose in oral pathology, henceforth onward. To summarize some key reflections of your presentations, so whole slide imaging and digital workflows are integral. Okay,
Yeah.
it enable remote access in helping us for second opinions and also improve efficiency. AI and machine learning along with digital pathology helps us in development of diagnostic and prognostic models and tools. The real world requirements associated with integration of computational pathology into the existing infrastructure was also very well discussed by you, and also the regulatory concerns associated with it. One recurrent theme that I kept coming in your presentation and I want to highlight here is that pathologists are a core for computational pathology.
Yes, yes, yes.
That they are required for algorithm development and for deployment, especially for
Yes.
analysis and also for training the data. So we are not just end users, we are actually co-creators of this.
Yes. We are co-developers.
So
And
a
it's, yeah.
couple of questions before I open it out to the audience.
Yes,
Uh,
ma'am.
what, according to you, is the biggest challenge of implementation of computational pathology in India?
Okay, ma'am. So first of all, obviously there is the monetary side, the budget, because we need to buy the scanners and scanners can be pretty expensive. The scanner which we are going to procure of Hamamatsu brand of or any brand, it runs around 90 lakhs to 1 CR. So buying a scanner is, it's a problem or it's a challenge. Then we need to have excellent storage, servers or cloud services, again they are expensive. Then we need to have manpower, to do annotations. It's a very labor intensive process. So we need to have someone who can sit and who can do good annotations, not bad annotation, good annotation. So they should be having some basic knowledge about pathology. And that's why I will just keep requesting everyone, especially the juniors, to learn something about AI/ML. So if you have some idea about AI/ML, you can make your own models. You can do thesis on those topics. You can learn, because the future requires, future wants that you should be AI enabled. There's a very common saying that doctors with AI knowledge going to replace doctor without AI knowledge, and this is very true. Very true.
And
So these are some of the challenges. Yeah.
makes it clear that we definitely require some cost-effective
Yeah.
models.
Yeah.
Definitely, the young budding oral pathologists can look into it and develop scanners, maybe make in India something cheaper so that we can bring this revolution throughout
Yeah.
India. So similar to what you said, that in future it's going to be something which everybody needs to know. So do you think we need to upskill our existing pathologists as well as budding pathologists and include computational pathology in the curriculum of oral pathology?
Yes, ma'am, definitely. I think like we also keep learning from different courses. We keep going to different conferences where we see something of value, like something on digital pathology or something on AI. So we keep learning, and we also keep conducting sessions. Like just few days back on 25th July, we have conducted one workshop on AI agents. Like ChatGPT is also an AI agent. So we keep learning, we keep sharing knowledge, and it's become very important nowadays to stay ahead of the curve. So
So I request the stakeholders to take this into consideration, that probably this could be included in the curriculum to make our young budding pathologists more empowered to know about this digital pathology. I now open it out to the audience. I will just take some questions from the chat box, Dr. Varun.
yes, ma'am.
Everybody is appreciating your presentation. They say it's a very
Thank
good,
you.
very informative session. There are no questions. I request the audience. There is one. One second.
Ma'am, we have a few questions there.
Yeah.
Dr. Ghosh, Dr. Dinkar is asking, can digitally diagnosed histopathological case be used as a evidence in medical legal cases? Can
Not as of now. Obviously, we need a pathologist opinion, even for signing out routine reports, so that treatment can be done. that require human intervention. So we have not reached that kind of a stage where we can give automated reports, and it's better for us. Otherwise, machines are going to replace us. So I think it should be in regulation that no report should be go without a human intervention. Otherwise, these companies, they will make such kind of microscopes and scanner, then they will do automatically scanning and reporting, and they will replace the pathologist out of the whole entire ecosystem. So it's very important that we stay firm that there should be human intervention, and no treatment or no medical legal case should accept AI generated reports.
There's one more question by Dr. Kartika. How does it help in narrowing down differential diagnosis in complex cases?
Yeah, so in complex cases, means rare cases which we come, not very routinely. Suppose there is a case of rhabdomyosarcoma, or it's a case of some sarcoma which we have not, of a routine knowledge. So in those cases, we may miss certain, features. Now, AI model will not do the same. AI model will be very unbiased. It will be updated. So it will identify the key identifiers of those cases, and it can help us to narrow down our diagnosis. So we have used these kind of models for some of the difficult cases which we come across, and they have given very, very good results. So yes, definitely we can use those models, those platforms for the differential diagnosis. But again, the final diagnosis should be given by a pathologist based on their own expertise.
There's one question by, thank you for that reply, Dr. Varun. Dr. Ghosh is asking the scanner machine cost, which was shown in the.
Yeah. So that machine cost around, I think, 34 lakhs. I think it was, I think 2 years back. There may be some changes. And that was a single slide scanner. And the multiple slide scanner, again, depends on brand to brand. The brand around somewhere around 90 lakhs to 1 CR.
Dr. Sorry, sir.
Yeah, only scanner. And then you need to have the entire ecosystem. So there will be LAN cabling, there will be monitors, there will be workstations. So kind of a expensive affair, but still the cost will come down when it becomes routinely used in practice. Yeah.
Correct. One more. Dr. Dinesh Kumar is asking, can you list the AI tools that are trained in your station?
So these AI tools are basically models, these are our own models. Like I have shown in our presentation, we have used those 3 models, but we have not commercialized them, or we are not, put them on any platform. We are just still training our models, because to train models, we require large amount of data sets. So it's an ongoing process. Maybe within another 2 or 3 years, we will commercialize, or we will share our models at least with our community, so that all the pathologists, all the oral pathologists in India can use those models.
There are 2 more questions which are slightly interrelated. Dr. Priya and Dr. Arvind Babu are asking regarding the ethical concerns, which you actually already covered. So I don't think so. We will take up that. And Dr. Arvind Babu is stressing that data security and confidentiality is something that you also already stressed regarding the same. Dr. Vaishnavi is asking, could I know the accuracy reduces if the whole slide scanning are not used?
Accuracy in terms of using the AI models, obviously, if we are taking the photographs of the image, like certain hospitals or colleges don't have the scanners. So what they do, they take the screenshot of from the microscope, or they have some softwares which can display the slides on their system, and they can use the screenshot. So obviously the accuracy is going to decrease, because these models, they work better on the scanned images, not on the static images. In static images, the pixels will be lost. When we zoom out them, there will be breakage of the pixels. So obviously that's a disadvantage of using those screenshots. So obviously it's going to work better on the scanned images.
There are no more questions, Dr. Varun.
I have one not question actually. No, you said something related to workflow and the computational pathology. How
Yes,
it's going to help workflow, reducing the workflow of in
Yes,
the
sir.
hospital setup?
Yes, sir.
Because ultimately, we have to work more towards the management of the patient. Whatever digitization or computation of the pathology we do it, ultimately we have to reduce the burden of the workflow on the patient.
Yes, sir.
How it's going to help us?
So, for example, let's take an example of a department which, for example, at IAOMP pathology department, they have more than 500 slides per day. So to screen, you need to hire more and more manpower. In those cases, at least for the common conditions where there is no pathology, the AI model can differentiate that like in radiology, like you take chest x-rays, the AI model can tell you whether it's normal or abnormal. So initial screening can be done by those AI models. Similarly, in pathology, the initial screening can done by the AI model. So it can tell you whether it's pathological or non-pathological. So it can reduce the burden on the existing manpower. So this entire workflow can make the department more efficient. They can process more slides. They can reduce the TAT. Nowadays in pathological department, like in general pathology department, the TAT is around 20 days, maybe 30 days. So it's a quite a long waiting time for the patient. The biopsy happens today and the report will comes out after 1 month. So it can delay the treatment. So once these system in the workplace, the TAT can be reduced to 3 days, 4 days. So it can make the department more and more efficient.
Yeah, thank you. Thank you for giving us an overview of computational pathology. We heard of digital, but annotation is the main help which will make us job a little more easier.
Yes, sir. Good annotations, good models, and they
Yeah.
can do wonders.
Thank you. Nice one. We enjoyed.
Thank you, sir.
Thank you, Dr. Varun, for this insightful session. To conclude, I would like to say today, as pathologists, we are standing at the crossroads of tradition meets technology. Yeah, our diagnostic acumen, clinical judgment, of course, is irreplaceable, but computational tools can empower us to do more, as Dr. Varun said. And let us continue to lead this shift not only by adopting these tools, but by shaping their development. And as Dr. Vanki said, it's all for patient care. So I'll now hand over the stage to Dr. Leena to finish with the concluding remarks.
Before Dr. Leena takes over, I just want to say that we have done an excellent beginning, and I should thank Dr. Varun and Dr. Punya also for taking the lead and giving a nice platform. I hope we would love to listen much more new ideas and what all new trend is happening in oral pathology. Thank you so much, Dr. Leena. For you now.
Yes, sir. Absolutely. I second whatever Vanaki sir said now. And can we have the certificates for the speaker now?
Dr. Leena, I just
Yes,
asked
Dr.
Dr. Punya, ask Dr. Punya madam whether she has addressed all the questions in the chat box. Some of them they
Yes,
were asking
ma'am,
the
did.
questions in the chat box.
Let's check again. I think I added all. There was one by Dr. Sri, which I didn't actually understand. If you want me to repeat, I repeat. Human error equals to mechanical errors or AI errors. And what about some hybrid ones or difficult diagnosis which needs? So that was one.
One by Dr. Vishnu Chauhan.
Who is asking, it just came now, I think. What kind of computer or software skill should pathologists have to use computational pathology and making of model? Do we have to learn codes?
Okay, so I think the basic idea about AI is sufficient. If you have some basic idea about the entire AI, how it works, what are the models, what is deep learning, what is machine learning, that is sufficient knowledge. Because models, anyone can make models. Models making is very, very easy once you have the basic idea. So just basic idea about AI, it's there on YouTube, it's there on Coursera. Just do a basic course or attend a basic workshop. I think then you're good to go.
And of course, we need to collaborate with technology people, and they are the ones who help us. Dr. Kavya has been asking, I'm sorry, I missed that question. What are the job opportunities for budding oral pathologists in this field?
Yeah, so on the one hand, we say that AI going to, take away our jobs. But on the other hand, also, if any company wants to develop good models, they need to hire persons who can do annotations. Even in our context, also, we are working on this MIDAS project with ICMR, and for that, we need to hire. So we have 4 research staff. Similarly, Punya madam also have, I think, 2 research staff. So these kind of, obviously, when you have such kind of projects and some kind of workflow, we need to hire manpower. So it creates a lot of job opportunities. So we are working with number of spokes. I think together with all the spokes and how we have, at least we have 20 manpower which have hired for this purpose. And even Google Google is also working on these kind of models. They have also very big team. So there is also going to be good opportunities when it comes to computational pathology.
There's one more question, Dr. Varun. Dr. Vikraman, he's asking any chances of bias between different AI models and tools for the same slide or case?
So we have not reached at that stage that we have compared those models, because there are only few models which are commercially available. And the models which we are training, obviously, since they are trained on our data, so there will be no bias. Once we check them or validate on external data, then we can see there is some bias. But if models are developed in the same ecosystem, there will be not much of bias.
I think I've covered most of it, Dr. Gurraj. There is
I
one
think questions are constantly flowing.
Ishwari wants to ask, will these tools explain the workflow, like how it is interpreted that diagnosis? Okay.
Yeah, obviously there are certain articles. We are also working. We have also put one article on this to make you understand how the entire workflow happens. So there are certain literature you can go through, and this will help in understanding the workflow.
Good.
I think we are done with the questions.
We're done with the question.
Yeah.
Certificate.
Thank you, Dr. Varun
You
and
show it
Dr.
once again. Show the certificate once again to everybody.
Yeah. Can you please display the e-certificate for the speaker?
Congratulations, Dr. Varun, for your excellent lecture. Very happy.
And now can we have the certificate for the moderator as well?
Of course, Dr. Punya also for moderating the entire
Excellently
session
moderating the session.
in a nice way. I hope we are going to have much more like this in near future.
Yes, so we are looking forward to it.
Sure. Gurraj?
Yeah. The certificates will reach you through your
Yes,
mail.
sir.
Yeah. Say something.
Yeah.
Nothing, sir. It was very nice. And thanks a lot for Dr. Varun and Dr. Punya. And I hope this journey will continue. And I should thank Dr. Leena for excellently coordinating this one, along with Dr. Shweta also.
Yeah,
My
Dr.
pleasure.
Leena, so we are also very happy for you for conducting in a nice way. And thank you so much.
Thank you,
And
Master.
sir,
My
with your
pleasure.
permission, sir, with your permission and Dr. Leena's permission, sir, next webinar will be on August 13th. The topic will be proliferative workers leukoplakia by Dr. Hazare, sir.
Very good. Excellent. We'd love to listen to sir once again.
Yes, sir.
Okay.
So,
So it is
later
better
we can-
now?
Yeah, sorry. It is better to announce when we are completing the next one. When we complete the seminar, we can announce the next one also. So at
Yes,
least
sir. We have all the webinars lined up in series
lined up to be there.
from August till December. We
Yeah,
have
very good.
speakers
Excellent.
and moderators lined up.
Yes. Thank you.
So can we conclude the meeting now?
Yes.
Thank you.
So now we come to the end or conclude the first webinar of IAOMP National Webinar Series. And on behalf of the IAOMP office, first we would like to express a heartfelt gratitude to our distinguished speaker, Dr. Varun Surya, for his enlightening session on computational pathology. So now we are in an era where AI tools are rapidly evolving. First it was ChatGPT, now we have Perplexity. So we need to constantly update ourselves. And we also have a word of thanks to our graceful moderator, Dr. Punya Angadi Rao, for guiding today's session with clarity and professionalism. And thanks to all the enthusiastic members and participants from all over India. Your presence today set the tone of vibrance, connected IAOMP community committed to a lifelong learning. And as Dr. Guru pointed out, we have our next webinar session online by a most eminent speaker, Dr. Vinay Hazare, on August 13th. And moderated by Dr. Chaitanya Babu. So hope to meet you all in the next session. Thank you, one and all.
Without pay.
Thank
We should meet everybody without pay in the next webinar.
Yeah.
Thank you.
Thank you so much.
Thank you.
Thank you.